When somebody has a distortion of reality, when somebody has a disorganization of thought, disorganization of behavior, disorganization of emotions, when somebody can no longer function normal as a person, when a person has withdrawn herself, embarking on social withdrawal, it doesn't want to associate with people. When the person cannot do his work, at times he have strange feelings, at times he has hallucinations, the person might have schizophrenia. What exactly is schizophrenia? And what are the symptoms of this their disease? Let us jump straight into the discussion. Schizophrenia is a term used to describe a group of psychotic disorders whose chief characteristics include gross distortion of reality, withdrawal from dealing with other people, and disorganization of perception, thought, and emotion. Simply put, schizophrenia is a disturbance in thinking, mood, and emotion. In the simple language, it's a disturbance of thinking, mood, and behavior. Or the disturbance of thinking, mood, and behavior. Simply put, that is a simple definition of schizophrenia. There are many experts are saying that there might be many types of schizophrenia. Some are saying that schizophrenia has a cause that stems from biological causes, that is from the person's body. Others are saying that there's a cause that stems from environmental causes. But whatever the cause, schizophrenia has many symptoms. In this video, I'm going to explain general symptoms of schizophrenia and individual symptoms that you can see that can vary from person to person. Let us first of all look at general symptoms of schizophrenia. No matter the person, no matter the type, we must see elements of these general symptoms in the person. One of them is disorganization in the area of previous functioning. Yeah, that means that the person has been able to work, care for other things, engage in social relations, take care of himself in general. But now, he is so disorganized that he cannot do any of this. That is a general symptom of schizophrenia. Another general symptom of schizophrenia is language and communication disturbance. Language and communication disturbance. In this case, the persons have a formal thought disorder. The person does not lack education, for example, but at this time, he seems as if he doesn't know how to speak again. He put words disorderly. His way he organized his thoughts and talk is out of order. But he's a person you knew very well that was learned. He know how to talk. But now he can no longer talk normal. He's not talking out of sense. His senses are disorganized. His thought process are no longer in sequence, as you can see from what he talks. Another general symptom of schizophrenia is the sense of self. The person may be confused at his identity. He may not even know whether he's a male or female. He may be even telling you that he's controlled by oceanic or kind of cosmic powers. That is not, he's controlled by this kind of spiritual, oceanic, or kind of mystic powers. Is a symptom of schizophrenia. Then you also have perception. The person will be having disturbance in perception. The person may not be able to sort out information correctly. He may feel that everything is pouring on him at alarming rate. He may not be able to filter information as they come through the senses. He might feel overwhelmed and may like to isolate himself. It's a general symptom of schizophrenia. Let us now look at other symptoms. This one can vary from person to person. Each person may have different aspects, but you might see element of this in schizophrenic patients. That one is one of them is disturbance of thought, speech, and activity. This one is reflecting the confusion in the person's thought process. A word might be out of order, as I mentioned earlier. Then another one is inappropriate emotional response. In this case, a good news will not bring joy to the person. You may bring a bad news, like somebody telling the person that somebody dies, and he begins to laugh. That is inappropriate emotional response. Another one is withdrawal. The individual will physically and psychologically pull back from interacting with other people. This one, they normally do it. They would like to stay alone. Stay alone. I would not like to interact with people. Another symptom of schizophrenia is regression. Regression. An adult might go back to a behavior of a teenager. You see an adult behaving like a teenager. That is a regression. It is a symptom of schizophrenia. Another symptom is delusion. As I said at the beginning, that this particular side might not happen simultaneously in one person, but each individual may have one or two of these in combination with those general symptoms I have earlier enumerated. Are you getting value from this video? Subscribe to this channel. And I have many videos on healthcare, on mental illness, of different depression, schizophrenia, drugs for mental disorder, how to identify I have many videos on this, as well as other aspects of healthcare. Subscribe to this channel and click on the bell icon to know when I drop the next video. And go through all my videos and watch them. And subscribe to the channel. It is free. Ask me questions in the comment section below. I would like to hear from you. I will answer you. I reply you. Now let us continue. The next part of the symptom is delusions. When we talk about delusions, they are different from the person might be thinking of something that is not there. Example is a paranoid delusions. We call it paranoid delusions, in which a person feels that somebody is out to kill him. Somebody's out to get him, but it's not true. We have a delusions of poverty. The person feels that he's the poorest person, that he is the cause of the downfall of his family. That is the person who causes the family to suffer. But it's not true. We also have another one on somatic delusions. The person continue to look at his own body every time on his own body, feeling that he has a disease that will kill him, that he has a disease that will want to kill him today or tomorrow. But it's not true. We also have grandiose delusions, in which case the person feels that he is the superhero, that is the number one person in the world, which is not true. And hallucinations. The person will be feeling or seeing something that nobody sees. He tell you he sees something. He did see a dead man. Tell you he see a lion. You see, or having a perception, or he hear a voices, people telling him something, but it's not true. Those things are symptoms of schizophrenia. This one varies from person to person, depending on the person's body chemistry, other biological causes. The severity and the number of symptoms you can notice varies from person to person. But the good news is that there is a drug for schizophrenia. Watch out in my video. I will tell you the super drug for schizophrenia, which when used has proved success in a number of cases. And you can use it to arrest the situation before it becomes too bad. You can continue with me, stay with this channel, and I would like to see you again in the next video.